Dr. Parsa Mohebi from Parsa Mohebi Hair Restoration. We do another procedure today. We have a small case of repair of 800 FUE to do a repair of a previously hair transplant with FUE. We have to repair the back, the donor area, and the hairline, and we'll look at it. A few years he had a procedure, a few grafts with a new graft in the front. Some of the grafts are a little bit pluggy and hairline is not as natural as it could be. On the other side, you see the hairline is not solid. We're going to make it nice and solid, and we're going to make it a little bit more irregular. A linear hairline, when you connect the dots, is not a good idea. It doesn't. Hairline, a normal hairline, a perfect hairline should be irregular and not perfectly symmetrical. That's what we're going to do today. So this is the donor area from the previous procedure. They use a new graft with larger punches. You see the little dots, white dots in the donor area. Unfortunately, instead of kind of making it feathered, they kept the follicles that are removed in a box. The problems that this young gentleman have is that it feels like when he gets a buzz cut, the box could be visible in the back, and this little red white dots. We're going to be doing around the area that they haven't been harvesting before, and we're going to try to remove hair from those areas to kind of blend in the area that he has at the middle.
Ready to go.
All right, Sarah, let's do it. What else is not? Hairstyle. Well, patient is a little bit worried about the hairstyle we're going to give him. That'll be your job. Do the shaving and make it nice and trim on the top, so you'll be like a perfectly LA style haircut.
Try my best.
Is there anything better than a coffee waiting for you in your office when you come in the morning? We're waiting for the patient to be sedated. I usually give 10-15 minutes after we give them the sedatives before we start doing the local anesthesia. So we have done the local anesthesia. We're making the sites now. This is very delicate, this procedure, because we are making the hairline as perfect as it could be. Some new graft procedure before. If you look very close, you see grafts, groups of like 3 and 4, very close to the hairline, which is a no-no thing in hair transplant. Hairline, as you can see, is irregular. Irregularly irregular. It's easy to make a straight line, but it's difficult to make it normally, naturally irregular. Frontal hairline, I'm using 20 gauge needle, which is very small, just for single hairs, and behind it we put 2s and 3s to give them bulk and the volume that you need.
Ready for another day?
Hi, Maureen. Yeah, we have to keep it clean because it's all white in here, so to make sure everything's clean and neat.
So we started extracting the grafts for our patient today. We have different methods to remove the grafts. We have robotic method, we have a motorized method, and we have manual method. Very important to use a variety of different methods because patients' hairs are different. So for every hair we use a different method extraction. Robotic, it's good for certain areas. For we started doing the motorized, which is a little faster, more efficient sometimes, but his angles are very steep, so we had to switch to manual, which is more time consuming. We remove that area, remove this area. As I told you earlier, he has this area at the middle that was extracted with new graft with larger punches before. Even out or feathered at the edges, we are skipping that area and going around it and removing grafts so it will be more even out in the whole donor area. Consuming, but it's more successful in certain cases. Extracting the grafts that are scored right after me. See how nice they are, the groups of 3s and 2s. So she has a special technique of she has to take her time. Sometimes some of them are anchored a little bit more than the others, but she is in constant communication with me so we can adjust our depths and our grafts. See the group of 3s and 2s and sometimes 4 occasionally. They're looking pretty good. So they're very nice and intact. 20s, so we can keep account as we are having them here. And over there we have Iris, who is, hello Iris.
Hi.
Iris is counting them on a microscope to make sorting them in groups of single, 2s and 3s. And for singles she makes sure that they're skeletonized, so in the hairline we only use single hair, not 2s and 3s. We're done with the procedure. The grafts are placed. We're going to take a look at it real quick. Alright, this is the hairline after transplantation. The front is nice and dense, reasonably dense. Closer, you see the grafts, how nicely they're sitting between his own hair. We didn't shave his head because he didn't want it. The other side, nice and dense. The corners are going back a little bit more. about like 1 inches. The front is more dense but more limited to the front. Hey, sir, how was your day?
Good.
Yeah? Okay, perfect. So we'll clean up a little bit the back and then we'll see you in the other room.